All right, good morning, everybody. Let's start right on time, and that way we get through a lot of stuff today. First, of course, question for you guys. How is it going? Anything that comes up that you would like to discuss, or difficulties, or comments before we get into it? If not, I want to remind you to just interrupt me when you have a question, when something comes up, and also, let me know what feels helpful to do. Like last week, we kind of went through some of the homework. We'll go through that again if that feels helpful. But what I want to do first this week is I want to go and do a quiz type of thing for the test. I want to talk about the test. I want to go back a little bit before we do the quiz, actually, and tell you how I would prepare for the test. Let me pull this up. Can you see my screen?
Yes.
Good. So I'm in the test review on the module test 2. And there, what I definitely want you to do is make sure you have downloaded this list, the term list, or actually I would print that out if you can, because these are all the terms that are on the second exam. All right, so what you do on the second exam, you then will take these terms and write them, type them into an empty slot on the test. And I will give you an example of the test question today. Then the other thing I think is beneficial, some of you've already written it in the Padlet a little bit as beneficial, is watching these videos because they go through pretty much all the terms, from the beginning to the end. And, at least just look into it and see if it's helpful. If I use the models in those videos, that are the models that I use on the test itself. And so it's very specifically the same stuff I use on the test and on these videos. And then the last thing that I think I would do is, in addition to reviewing the video, or instead, but I think this is probably more important than the videos, if you already have a grasp of the terminology, and that is going through these pictures, and I either print them out, although they might use a little bit of ink, depending on your printer situation, or just download them even on a phone. You can blow it up and then find the terms and find all the muscles that are on the test list, the term test list, and indicate all the parts, because I use these photos or similar photos of these models for the test that we then have for test 2. And make sure you only, on the homeworks, you only go, you can do more, but I will focus on the terms that are on the list. And the list, this list is all the terms that are also in each individual labeling and coloring and sometimes answering questions homeworks. And I would do those first. In terms of the test, I think that's the foundation to do those first. And then the other thing in terms of getting, ready for the exam, of course, flashcards are always great. When you look at my modules here, come on, baby. Go. It's not the skeleton. We want the muscles now. Yeah, that's pretty good here. Muscles. When we look at the muscle video parts here, underneath, I got these tips, pro tips. So I got one that's the, when you study muscles, one that's the cadaver videos. This is just a link to all those cadaver videos that are then embedded also in these bullet point things in here, like down in here. And, if it's not your thing to watch cadaver things, then don't even worry about watching those. But if it is, it's extremely helpful. But then the other thing I think in order to study for the material is that's helpful if you're inclined to do flashcards or feel okay spending some time with doing that, is this link, because you can print this out and then you can cut out these things or just even label them and use them again to understand the muscles better. These are all the muscles, so this is muscle stuff. And then lastly, what I like also is, because some of you in the Padlets, I always use I always look at the Padlets, so make sure write stuff in there, because then I can write tips back to you. And one of the questions that came in there frequently was, or somewhat frequently, was the muscles. It's hard to see the layers of the muscles and where they are attached. And so then that's absolutely true. I got that same problem even clinically when I work on them people, and I've been doing this kind of work since 2000, I don't know, 1 or something, long time at this point. But I created a picture that looks like this, and you see my favorite muscle picture, and I have all the muscles that you really basically ever want to know are on here. I know it looks like it's not that many, but it is more than we think. And what you do, or what I do, is I can zoom in on my iPad. And when I look at muscles, go like, where is this exactly attached when I work on a patient? And I can feel like, oh, look, this is where we haven't done this yet. Hold on. This is for example, this is, we haven't done upper extremity. We've done trunk, right? We've done trunk. So if I look at the abdominals, for example, this is where the abdominals attach. The rectus abdominis, rec ab. Sorry, my writing is not that great. I've done this first for me, but then I realized it might help some of you guys too. So the rec ab is attached here, rectus abdominis, that's a top layer. And then here's the attachments of the external oblique, the internal oblique, and then even the transverse abdominis. I'm not even sure if we have that on the homework, but not all of them we have. But you can see how you can see the muscle attachments into the bone, and then the muscle is sort of aligned, and then you can see the other side of the attachment. And so that's why I put that picture in, even though it might be a little bit overwhelming at first. But it might be also very helpful for some of you guys. And a lot of these muscles, like the foot muscles, we don't do those to that level. That is not anything that I would expect anybody to recall from memory. I do not have that capability myself. I always have to look those up when I work clinically. And I find it very interesting because I have people, then they go like, the clinicians, they think, oh, you got to remember everything. And then you actually talk to them about some specific stuff and you realize they only remember some superficial stuff. And if they were actually not so cocky and look stuff up, but not just think they should, then they can go much deeper in their analysis. And so, well, that's at least my understanding of things and my way of looking at it. But make sure you take advantage of some of these pro tip things in the lecture part of the classes when it comes to the muscles. The other thing, we are on the test right now, but the other thing I want to point out real quick, because I keep forgetting otherwise, is I have embedded now videos under the questions, because what I've done, and I don't know why I didn't think of that before, but what you can basically do is you can basically cheat now, because you can watch these videos under the quizzes and I go through all the questions. Yeah, I know I look very goofy there. You can go through, it goes through all the questions, and then you can take your own notes, and then you can take the quiz after that if you want. And I don't mind that, because, it's really not cheating, because you actually just manipulate and work the material in a different format. And if you spend another half hour doing that, if that's more easier for you than reading the questions only, then hey, no problem at all. I don't think so. Even if you want to go right ahead and start watching these videos first. Maybe some of you get enough info that way as well. No, I shouldn't say that, because that's probably not proper. But you know what I'm talking about. Some of you know a lot of this stuff already, so you don't have to put the same amount of info in as others necessarily. Anyway, let me not be blabbering around. Let's see, we got a few of you in here. Are there any questions at this point to what I've been talking about so far? Because if not, we're going to go right into doing a little bit of a quizzy thing.
I got a question real quick. It's
Yes, sir.
not in particular about what you just talked about, but when exactly is the exam due? Like what exactly is the date we're going to be doing the exam?
If you look in the syllabus here, I got it. Exam date range 3/18, which is Friday, to Tuesday 3/22. But I always extend that, so that's gonna be Friday to Friday.
Okay, cool. That's all I wanted to know. Thank
So
you.
it's 18, and then what's the Friday after? The 25th, something like that.
Cool. Thank you so much.
Oh, you're welcome. Any other questions that are coming up right now? Well, if not, it's your own fault, because then I want you to take out a sheet of paper and start. We're going to start a little quiz. So if you have a term list, this thing, take it out. Take out all the info you need and that you created over doing these, lectures, these weeks that give you all the info to figure out where what is. I want you to make cheat sheets on this stuff. I mean, that's how, at the end of the day, making cheat sheets is actually a really smart idea, because you're consolidating the information the way that you understand it. It's just, don't use it on the test. On my test, you can use it, but don't use it when you're not allowed to use it. But by the time you finish making a cheat sheet, I guarantee you most likely know what you need to know from it. All right, so let's do this. Number one, I would like you to tell me what is this landmark here between the eyebrows called? That's number one, the landmark between the eyebrows. And I do not say it, just write it down on a piece of paper on your end as number one. And then when we solve the quiz, then I want you to shout it out and say it all over the place. So, because speaking out also helps us remember it better. So number one, what's this landmark? Number two, in the back of the skull, what's that landmark? What's that landmark over here? Number two. Right here. Then number three, when we open the skull up, in here we had this ridge between that foramen magnum, well, next to the foramen magnum, more or less. What's that ridge called? Number three. What's that ridge called? You let me know if I go too fast, okay? What's that ridge called here? And then we go to number four. And number four, wait a minute, hold on. Number four, I'd like you to tell me a muscle that goes up and down here on the side of the mouth. The chewing muscle goes up and down. That's number four. Number four. Number five, I want you to tell me the muscle that's on the side of the lip here, on the corner of the mouth, on the angle of the mouth, and goes downward and pulls the corner of the mouth down, as in we're unhappy. Number five. That's good. Number five. We'll do a few of those. Number six. Again, let me know if I'm too hefty and too fast. Number six, I'd like you to tell me, what is this bone called here? This round bone, which is well, no, I'm not going to say more. This round bone, what is this called? Number six. If you could give me the name, that would be great. Number seven, on this generic vertebra over here, what's this part called? The big part in the front here. Number seven. Number seven. Number eight. This is the front of the chest, I mean the rib cage.
Can you repeat number 6 and 7 again, please? I'm so sorry.
No, that's all right.
Thank you.
Mhm. Number 6 is here, this round-shaped bone. And number 7 is this is a whole bone, number 6. Number 7 is this landmark. I should differentiate again. Landmark is a part of a bone. Like this is the whole bone, that'd be a vertebra. Landmark is this part. On this side, this is the whole bone that I'm asking. And here I'm asking the landmark. So that's number 7. And then we go to number 8 from there. And now we're looking at the front of the chest. So these are parts of the ribs, the cartilage, and then this is the breastbone as a whole. And I want you to tell me the landmark at the bottom, the tip of the breastbone. What is that landmark called? That's number 8. And then number 9. What is this whole bone called, number 9? The whole bone, number 9. Yeah, and if I'm too fast, interrupt me. Number 10. Now we go to the arms. Number 10, I want you to tell me on the back of the shoulder blade, what is this ridge called that goes from the vertebral part here? The vertebral column is right here towards the shoulder tip on the outside. What is that ridge called? That's number 10. Number 10. 10. And then number 11. All right, look at the shoulder blade here. Then this is the humerus going down. And I want you to tell me the bump here, which is on the medial side, on the inside of the, elbow part of the humerus, the distal part of the humerus. What is that called, that landmark, number 11? Lots of silence. Is this too hard? Well, no, we got to do it anyway. We got to do it a few times. And then we're going to be fine for the test. So don't worry if it's really hard right now. Number 12, let's just go and talk about the hip joint here, the hip itself. So in the back, in the hip, this is the pelvis parts, okay? So this is that bone that we had before. And then this is the crest of the ilium. But I want you to tell me, what's the bump in the back of that crest? The big bump in the back of the crest. You can touch it. It's next to your butt on the back side. I got to ask it. It hurts right now on my end. You can use abbreviation for that, if you know what I'm talking about. So that's number 12. Then number 13, what I like you to tell me is the bump down in here. This big bump is the sit bone. So that's where we actually should sit on. We shouldn't slouch on our booty. We should sit on the sit bone. What is the technical term for that? That's number 13. Number 14, number 14, I would like you to tell me, we get from the pelvis, we get into the upper extremity here, and then there's this round, big bump on top of that thing. What's that called? That's a landmark. And then let's do last one. Number 15 is, what should I do with number 15? Yeah, look at that. I look at this puppy here. This is the front. This is the chest plate. And I see this muscle going up and down here. And then on this side, no, on this side, I see some bone. See that? On this side, I have skin. Now, of course, that's not really proper to want to, use that as landmarks. But what we appreciate here is that on this side, the top layer of muscle is actually taken away. And on this side, you see it's more dull here. It's not as bright. And this side, the fascia, the top layer is still there. And also the top layer of these outside muscles here. And you can see, if you look a little closer, you can see how the fibers here go up and down sideways. Like if you be that person and you take this hand here, which you don't have, but if you will have this hand, and you put it in your pocket, that is the fiber of the muscle go like your fingers would reach into your pocket. Front pocket, not back, front. On this side, it's completely the opposite. See, the fibers go inside, go up opposite. If you would put the hand in this way, it's not, it's perpendicular. So this is actually the internal oblique muscle, and this is the external oblique muscle. Wait, we have obliques, right? We had the obliques on the trunk, right? Anybody? Yeah, we did. Okay, good. And so what I want you to tell me is, what is this muscle called that goes up and down in the front, the top layer? It's also known as the six-pack muscle. All right, good. Okay, so with that, let's go and solve this stuff. You guys are doing quite well here, I'm sure. So what I want you to do now is I want you to take off mute. I know there might be some background. I mean, if it's really too much, don't. But I want you to shout out and tell me, everybody, not just one, what is this called? Number one. What's number one?
Glabella.
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 I don't have 14 people on the call. Come on, speak it up.
Glabella.
There you
Glabella.
go. There you go.
Glabella.
There you go. What's number two?
External occipital protuberance.
External occipital.
There you go. External occipital protuberance. We also call it the EOP because it's such a long word to say. And then when we go down in here, what's number three?
Petrous portion.
Good. Can I get more?
Petrous portion.
There you go.
Petrous
Good.
portion.
There you go. Good. I know. Number four.
Masseter.
Masseter.
Very good. Masseter. That's a chewing muscle. That chewing muscle pulls the jaw this way. And then we got one here, the temporalis. It goes into here, right to the coronoid process, and it pulls the jaw a little bit this way more. And so that way we have multiple forces closing that jaw. All right, perfect. And then this one was a difficult one. What's this one called? Number five.
Depressor angular oris.
Depressor
Good.
angular oris.
Depressor angular oris.
Good. You guys are getting it. Excellent. And then number six. Hello.
Atlas.
Atlas.
Atlas. The Atlas. Like in the Greek mythology, the Atlas is holding up the world. And the Atlas, for us, the world is the head, I guess. Oh my God. I shouldn't be so big. My fingernails look horrible. What's this called? Number seven.
Body.
Yes.
Body.
Body.
Body, the body of the vertebra. Perfect. Body is good. Then you don't need to write more than that. That's perfect. And then where are we at? Number eight.
Xiphoid process.
Xiphoid
Simon
process.
process.
Xiphoid. Good. You're speaking that out real well. That's an interesting word. I love using that word. It sounds so cool. And then hint. When I say those things, it's probably on the test. What is this bone called?
Sacrum.
Good. Sacrum. Now, on the back spine, what's this called? Number 10.
Spine of scapula.
Very good. Spinal scapula. And then we go on the elbow, we go down distally to this bump, number 11.
Medial epicondyle.
Very good. Medial
Yes.
epicondyle. Excellent. And then we go to the back of the pelvis into this one, number 12.
Posterior superior iliac spine.
Very good. If you are having a hard time with that big word, just say PSIS. People in anatomy know what you mean. Yeah, there you go. And you can write in the test, you can write that. I'm taking it. Down here, the sit bone. What's the sit bone? Number 13.
Ischial
Ischial
tuberosity.
tuberosity.
Very
Tuberosity.
good. Ischial tuberosity. Excellent. And then we go to D, number 14. That was an easy one. Come on.
Head
Everybody.
of, head of femur.
Head of femur. Everybody. That was
femur.
an easy one. And then the last one, not so easy maybe, when we get to the gut,
Rectus abdominis.
rectus
Rectus
abdominis.
abdominis.
Excellent. Excellent work. How was that for you guys?
That's
You
good.
feeling confident? You feeling like, holy cow? How you feeling? You doing all right?
Pretty good.
Yeah, it's a good eye opener.
Good, good. So if you do that a little bit, and if you actually go through specifically this quiz a few times, you'll be having an upper hand for the test, okay? I'll try to guide you a little bit. So that's one thing that I wanted to today. And then I wanted to talk briefly about the homework stuff. So if you, on a discussion forum, if you don't get all the points, it's usually because some of you do not reply to other classmates, although that's very few of you. That's when you don't get points. Or then if somebody replies to you, makes a comment on your post, then you have to say back something to them that we close the loop. And so that's the last 2 points. And if that, at the end, I go through them, because if nobody answers to your post, then you're not going to have to say anything. And I'd of course give you those points then at the end. So don't freak out if you got on all your work and you only got 8 right now. I'm a little behind with those. It's a little harder to those to go through them all the time and look who responded back. But for sure solved it at the end. And with that, I also want to tell you that I always go back. So if you don't get all the point value at first, do not worry. Just figure out on the rubric what you didn't do. Did I not color the muscles or something? I'm a little picky about it, because those are sort of at least a few of my guidances in terms of doing the work. Of course, there's differences and preferences everybody has, but those are the things I would like you to do for these exercises. And so if you didn't get a full point value, it's probably because you didn't color, you didn't label, you didn't answer the questions. You go back then and do those and upload it again, and then you get all the points. So do not worry about that the points are not finished when the thing is finished. So I want to make sure you know that, so don't freak out. The other thing is I still have issues somehow with some gradings, that the grade in Canvas looks different than your real grade is. If you do all the work, if you get the quiz the questionnaires, which you should, because now you got videos even, so it shouldn't be a problem. If you get all those points and you do the busy work, you'll be doing fine in this class. That's most people, or practically everybody who does that gets a good grade. The ones who do not do that end up getting a slacky grade, unfortunately. But that's usually very few. All right, then the other thing is I want to make sure, and I'm really grateful for you guys to share a lot of your thoughts on on the Padlet. I go through them. I do also have, somebody had some clinical question, like how much does it take to get a muscle strain fixed? That's totally okay. I try to answer those as well, because I got some experience in that field after all these years. And so please don't worry about asking those things. I do have, this is also where I posted that picture again, my favorite muscle picture that I already went into. And what else was there? That's about it for that part. But I answered these things, so go through it a little, after, usually Monday morning, I answer those things, and then maybe get a couple more tips out of this. If you feel like it. Okay, that's good for that. That's all I wanted to say for that. Again, any questions, just talk to me. Do you guys want to go through any of the homeworks that we have, the labelings?
Yes, please.
Which one? The axial?
Yes, please.
All right, let's start. Let's do that next. No, let me pull it up. How can I pull it up on the bigger? Here we go. Come on. There we go. Okay, so let's see. We got the terms here. So we're looking at trapezius. Let me make it a little bigger. Oh, you're not seeing me. Do you see my screen or do you see me? You probably see me, right? No. You see my
I
screen?
see,
your
leave your
screen.
screen.
Do you see the the internet or you see the other one? The
I see the coloring assignment.
oh crap. Okay, then let's go. Let me do. I want to do the PowerPoint because then I go through the stuff like that and you can see it. So somebody help me. I need a. Yeah, now you see my PowerPoint, right? So the first muscle, that's the trapezius, correct?
Yes.
Yes.
All right. So when we look at the trapezius muscle, does anybody still have problem with origin insertion? No? All right, then that's good. So the trapezius muscle is this big muscle here, this big chunk of muscle here. And so on the picture, that's the first picture on the right side. And the muscle is outlined on the left side. It's sort of a little darker gray. You see that?
Yes.
And so that's that. And then when you go for the origin, so the attachment is the EOP on top here. It goes all the way down on the spine, all the way down to T12, which is the last part where we have a rib attachment. You see that down here. So it's a really broad, big muscle. And SP stands spinous process. Ligamentum nuchae is when you look from the side on the neck, you actually have a thick ligament that goes backwards because not everything can attach right on the spine here. It's just so many, a spinous process. It's just too many things. And also it provides a little bit of the bounciness of the neck here. So that's helpful for it as well, but that's the ligamentum nuchae. And so the trapezius is the most superficial muscle. So it attaches into this ligament here partially. And then as an insertion goes, we're going to go to the clavicle in the front. That's in the front here. And then all the way around to the back in the spine of the scapula. You can see how the fibers go up and then some of the fibers that go down as well. So when you look at the action, you have a lot of action on the glenoid area, on the scapula, really the scapula. It holds the scapula, it raises it up, it retracts it, brings it back. And it also, when you see how these fibers can pull here, they can bring the glenoid cavity downward a little bit. And then, no, upward, I mean, sorry about that. You pull in here this way, you go this way, so it brings it upward. And then also when you stabilize this part, and so this is kind of interesting where sometimes an origin and insertion can flip a little bit, because also when you look at the neck motion, you actually extend, you bring the neck back when you pull on these fibers as well. And so then this is actually, technically speaking, for that motion becomes the origin and that the insertion. Don't worry, we don't go to that level of nitpicky. We don't have to worry about that. But it's just if that question comes up in your mind. When I studied at first, it kind of came up. An interesting part about the most superficial muscles is that they do most of the motion. So when you look at a shoulder motion, that's a big motion. This is sort of a guiding muscle and the main muscle, and then the deeper layers of muscle are more stabilizing muscles often and move the deeper joints around. That's just sort of generally speaking. All right, so that's trapezius. Again, if any questions, just stop me and ask me questions. Go and don't wait for me to ask. Just interrupt me. Because the next muscle we're looking at is the sternocleidomastoid. Where the heck is that? Where is my SCM? Really? Uh-oh. Hey, how come I'm missing that thing? Did I miss that in the lecture?
No.
It was in the lecture. Why is not that there? Well, let me just outline it here at least. It might be in the extremity, and I just don't get it right now. The sternocleidomastoid is a very superficial muscle in the front of the neck too, and it attaches on the sternum. The name says it all. It attaches on the sternum, which is right here, the chest bone, and then a little bit on the clavicle. That's the cleido, and then it goes and reaches behind the back, at the back of the skull, under the ear, on the mastoid process, and that's the mastoid part of the name. So sternocleidomastoid. It's an interesting muscle because when you want to feel it, you kind of hold your forehead and push into it and turn the head a little bit to the side, and then it bulges out. Let me show you. So it's like you do like this, you push into it and a little bit turn it a little this way, and then you can see how it bulges out in here, and you can touch it on you. And so that's, then you know which muscle you're talking about. And so that's actually what it does. It helps flex the head when you pull both sides. And then when one side contracts, it helps pull the head to the opposite side of that. So that's what the sternocleidomastoid does. Really cool muscle. It's an interesting muscle. A lot of people get pain in there, and it's a little hard to work. And see, it's pretty broad here, the way it's labeled, it's done here. Oh, you can't see that. Hold on. And the way I have to flip is not that cool here. So here you see it, it's pretty broad here, the way it's done. So it's a fairly big muscle. A lot of the vascularity from the head goes through it. So headaches can be caused because this muscle is very stiff and tight. Also whiplashy stuff can cause this muscle to be in trouble. The next one is the scalenes. It's one of my favorites. The scalenes are here on the side of the neck. They go to the first and the second rib, and from the lateral portion, the tip of the spinous, have the transverse process on the side of the neck. One of the things that's interesting clinically is that the nerves go through it, that one. Oh, okay. The nerves go through it that come from the neck, go to the upper extremity through that. And that's clinically, let me find it here, hold on. That's clinically very interesting because we're going to squeeze that nerve complex. So here are the scalenes on the side. Where are they? Hold on. God, sorry, I'm a little discombobulated here this morning. I don't know where these things are. I was grading all morning and all night. Sternocleidomastoid, the scalenes are here on the side. And so the nerves coming from the neck going into the arms go through them. And so if these are really stiff and tight, and they often get really tight because they're attaching to the first and the second rib. And if we use the arms a lot or have to hold them up because we type a lot, for example, then they can get really stiffy. And then the nerves get pinched and we get symptoms down into the arm, and then people think that's carpal tunnel syndrome. So that's kind of an interesting reason why they are important clinically to study. So those are the scalenes.
Excuse me, the scalenes on the coloring assignment, are they on both sides of the spine? It's darker on the actual.
Yeah, this too. No, wait, here. These.
Yes.
Yeah,
so
yeah.
it's on both sides. Okay.
Mm-hmm.
Thank you.
Yeah, you don't have to indicate on both, but this was a very decent picture to sort of really show them where they're at and how they go. I found. Oh, and then the intercostal, that was a little bit of a challenge for people, some people. These are the externals. You see how the fibers go up and down. And so when you feel like these fibers contract, you can sort of see how the lower rib will pulled up. That's why in the external intercostals, the origin is up here and the insertion's down here. And so the job they have is to pull the ribs up and out. And so what they do that way is then they make the volume of the rib cage bigger. And that increases, when the volume of the rib cage increases, that's what inhalation is. Because the lungs are attached to the ribs, and they inflate passively. They get bigger passively because those muscles contract. The other one that does that is the diaphragm down in here. That's the other one that does that. And then the internal intercostals are these on the side. So those fibers don't go up and down. They go more like a little diagonal. And when they contract, they're attached, originated here in the bottom, the superior border of the rib below. I know that's weird terminology. And then they go insert in the inferior border, the border on the below side of the rib above. And when they contract, they pull that superior rib down and inward and compress the volume of the rib cage, and therefore exhale or help exhaling. And exhalation is fairly passive. So when we talk about muscle use in exhalation, we're actually talking more about forced exhalation actually at that point, even. Not just quiet breathing like we're doing right now. And then the last muscle there is the diaphragm. And the diaphragm is attached around the ribs and then on the spinal column. And so the central tendon there. And so it goes into a central tendon in the middle. And so that's kind of a weird, what do they call, parachute shaped muscle that when we inhale, it pulls downward, and that way look at how small, this is why that picture is good. Look at how small the volume is here of the rib cage, between the rib cage. That's the lungs. And when that goes down and we contract it, that volume of the rib cage is the whole thing. And so that's really a huge, huge enhancer in breathing. And so that's actually why belly breathing is very, very important. So don't underestimate doing that and test that. I mean, train that, because that's when we're told, don't stick your stomach out. Don't breathe with your chest. And that's actually baloney. I mean, if you need to make sure your stomach doesn't stick out for a hot second, then that's fine. But normally speaking, that's not what you should be doing. All right. Oh, I know what the problem is. Hold on. What my problem is here? My problem is that I didn't use the muscles of the trunk. I used the extremity muscles already. Now we're going there. All right, so let me make sure I touch on the ones I missed. So the SCM was here. That was in the lecture. So you see the attachments really nicely here. Then the scalenes was here on the side. That's also very nice. You see the nerves coming out. That's kind of good to remember, that a lot of upright. Look at all the pains that these things can create. And then we had after that, we went right to the breathing muscles. And so those are the breathing muscles. So these are pictures in the booklet, but I go through it in the videos. And on at least my computer, I can take a screenshot from a video. If I take a video, I just pause it and take a screenshot if I want that. And then I copy paste it in a document. So I have all these data points on there too, if I feel like them. But this is a pretty good picture that talks about inhalation, exhalation. And so the muscles involved as the principal ones are the breathing ones, the quiet breathing ones. So expiration here is passive recoil, and then active expiration is when you forcefully breathe out. And inspiration is mostly done by the external intercostal, like we were talking about, in the diaphragm. And here's the picture of the diaphragm, where you can see how it's like a parachute shaped thing. There's the attachment. See, this is the central tendon, and then this is the rib cage around here. And of course, also the spine. All right, next muscle. What's next on the list there? Let's go look real quick here. Oh, the erector spinae and then the obliques. Okay, we're getting somewhere. Good. So the erector spinae, I think we talked here about them here. There you go. Here they are, right? These are all the back muscles all together. And I basically am interested in the whole group. When we go separate them out, they're named Spinalis, Longissimus, and Iliocostalis. I actually like those names because spinalis means it just goes right on the spine. So we have some fibers of the erector spinae, they go from spinous process to spinous process very centrally. And then we move a little laterally, and you can often feel in people, there's these big bulges on the side of the spine. You see these puppies here, these chadam. Of course, these are extra big. And so those, the one next to the spine is called the longissimus. And I always remember that's the long muscle. You see that over here. You see that muscle goes all the way from down here, all the way up. It's very long. So that's the long word in there. And then the last one I use is iliocostalis. Goes from the hip bone, is more lateral, and then it goes to the ribs, and it attaches to all the ribs. So those are sort of the three layers, the three bands on each side of the spine. Well, two bands on each side of the spine and one in the center of it going up and down. So that's what I want you to know about those muscles there. And if you look at origin insertion, we just generally, you know, use the hip bone, the ilium, iliac crest, the sacrum here too, of course. A lot of it comes to the sacrum. And then the ribs, some of the ribs, and the vertebra, and then we reach up above it, two more ribs, two more vertebra above, and also to the skull. So that's what I wanted you to indicate with that. And then next we have the obliques, huh? And what is there? Are these the last ones? The abdominals, is that right? Anybody? Help, is anybody
Obliques,
here?
it's external abdominal oblique, internal abdominal oblique, transverse abdominis, and rectus abdominis.
So yeah, if I look at all these abdominals, let's start with the rectus. That's the first top layer, the top layer. That's the six pack. So that starts down here, and then it goes all the way up here. So it goes from the pubic bone to the xiphoid process. It also attaches a little bit to those lower ribs. It's just traditionally they don't list those. It flexes the trunk and compresses the abdominal content. The interesting thing about that muscle is it has this inscription. So it has one right by the belly button. So there's actually a muscle from the pubic bone to the belly button, and then from the belly button up to about halfway to the rib cage, and then all the way to the rib cage. And so we got these different sections. And what's interesting about that is that when they all contract individually, so this muscle is very, very strong because it contracts here a little, contracts here a little, contracts here a little, contracts here a little bit. And as a whole, it contracts that whole front part of the body. So that's the rectus abdominis. If I go below that, I go to the two obliques on the side. Actually, let me use this picture because it's nice to see it. So I go to the two obliques. Here we see one oblique on the outside. Then here's the second oblique on the inside. And then this is actually the transverse abdominis. And you see the fibers going across. So as I said in the quizzy that we did, the external oblique, the fibers go like if you were to take your hand and put it into your pocket. So from the outside inward towards the front. And the internal oblique go the opposite side of that. They're deeper also. And then the transverse goes across. And so external oblique, origin attachment, or rib, the borders of the rib here, a little bit the rectus sheath, and then it goes into the rectus sheath, into the iliac crest, and also into the pubic bone. So that's the external oblique. So it starts out here by the ribs and goes towards the midline. And you know, sometimes these anatomical terms are a little bit complicated, so and a little bit confusing to write down. So I also want you to visualize and even maybe use your own words. You know, they go from the outside of the ribs towards the midline, and whatever it takes for you to visualize, because ultimately that's really most important, that you know where they are and what they do more than just their names. And we do an exercise this week that will integrate that information. And then the internal abdominal oblique start at the iliac crest from here and go upward into the ribs, into the costal area. The ribs are the bony part, the costal cartilage is the cartilage part. And then it also goes into the pubic bone forward and downward. And so that's the internal abdominal oblique. And the transverse just wraps around. The transverse abdominal oblique, I have here a way to exercises because this is a very, very important muscle for core strength. If you look at core strength, it's this muscle wraps around the belly and compresses the content of the stomach. So its origin is the costal cartilage, the crest, the lumbosacral fascia. That's the stuff in the back, that white stuff in the back. And then it comes forward into the linea alba, which is the white fascia in the front, and the pubic bone on the bottom. So it compresses this content. The other muscles that are important is the pelvic floor. That's where Kegels come in to strengthen that and make sure that is not weak And then the diaphragm, but that's the breathing muscle. So we you know, strengthen that with cardiovascular exercise and stuff like that. All right, so that's for that homework. Is that all right? Any questions? Talk to me. No?
No questions, Professor.
All right, is it helpful though? Does it make sense?
Yeah, it was very helpful. Yeah,
Yes, very
informative.
much so.
Yes.
Thank you.
Yes,
Alright,
thank you,
good, good.
Professor.
So then let's do, oh, we're almost finished. So, well, I'm thank you for staying with me so long. But as long as it's helpful, we're good. Otherwise, we change in course, and you let me know if you want to change course. But I want to briefly now finish up going through this coming week. So this was last week, and then now we got two more. We got upper extremity, lower extremity, and then we get the test. Oh, I was going to give you an example of the test, right? Let me do that real quick. I didn't do that. Sorry about that. Now you have to wait all the way to review this thing to get to that. There we go. Muscle bone test. Ta-da! Preview. Uh-oh. So it's 2 hours. You get 2 hours, 54 questions. And these are, so look, here's the first one. These are label things. So you get a picture with a label and there's a number on it, although you don't need to worry about the number because that just corresponds with this. But that was in the classroom. And then also I have an external link to the picture in case this is a little goofy. So this is, sometimes the pictures, try to do this on Google or so, sometimes on Safari, they're a little bit challenging. Or actually, I do some of these tests when I take classes, these kind of tests best even on my phone, actually. And then the other thing I did on here is I made a video a little bit, like you see 16 seconds and I explain it. All right, the first question is a landmark that is between the superciliary arches. See that? And so then you get that, and you can watch that as many times as you want. Of course, there's an external link also for the same thing, just in case that internal, the embedded link doesn't work, sorry. And then when you do that, then you go here and you type in, you know, the right word. You go look on your term list and you go down the term list, it's actually in sequence, the whole test. So that should also help. And then you go and write down the word and use the right spelling as well as you can. If you misspell it, the program very likely will see it as wrong. So when you finish the test, you're gonna submit it, and then you're gonna be sometimes a little shocked because it looks like you got a low grade. But I always go in the back and look at it because anything that you misspell, I'm gonna, you know, give you the credit for. And so I want to make sure you don't freak out at first. So usually people do pretty well in this test. So that's how that looks in terms of how it's done. Is that any questions with that?
No.
Okay,
So
so
all the
Yeah.
questions and exams are like that?
yeah,
Oh,
54 questions like that.
I actually did the same, like I just like put the numbers on the pictures, like you.
For the homework?
No, for the test, for the review, I printed the pictures and I like label it with numbers of the list, like number 1, 2, and.
Oh yeah, that's good. Yeah, and then
Like
you have a list.
Thank
Yeah.
Uh-huh.
And then in the test, you just have to type in the right word from the term list.
Yeah.
And then transfer it over as well as you can. You know, the other thing you gotta make sure is this friggin' spell check. Sometimes it changes the spelling automatically. that happened before. And so make sure, but I think I've made it so you can go back and forth in the test. All right.
I got one question if I can get in there real quick.
Oh yeah, of course.
Maybe somebody already asked this question, but so I printed out pretty much everything you on a pro study thing. I got the like, you know, the bone structure, basically everything off the term list that you said we should print out as far as like reference. If we were to label everything off the term list right onto those pictures that you had us print out, is that a good way to a
Yeah,
good
then
way
you're
to.
set. Then you're set.
Okay, yeah. Okay, yeah.
Then
Cool.
you're set. I mean, you might not find all the the pictures have all the terms because I kind of did them in a hurry.
Got
And
you.
so maybe something you can't see, but that's the only caveat on that.
Okay, cool. That's all I want to know. Thank you so much.
All right. No, that's the best way. And then if you have questions, go back in the labeling because you can review those videos or short videos in there on the labeling, the corresponding one, or do the review videos in the review section.
Yep. Okay, got
That
you.
would be in the order, okay?
Yep.
Then
Thank
sure,
you.
Thanks for that. Cool. Excellent. Yeah, everybody should follow that format, I think. That's what I would do. Perfecto. All right, let's go through this week's briefly. Again, we have mostly done the material. What we have left now is the upper extremity muscles and the lower extremity muscles. So now is mostly start really focusing on these terms. Spend more time on the test prep. Next week we're gonna go through, do another quiz thing again, like we did today, maybe a little bit more extensive, so that way you can practice, and then you're ready for the test. So when we go through the upper extremity muscles, first we see is the videos, of course, and then the main concepts. So we have a few sections we look at. We look at shoulder anchoring muscles. Those are the shoulder, I could say shoulder blade anchoring muscles. Those are muscles that are that I want to go through that are attached to the shoulder blade here, for example, the levator scapula. Levator means elevating, bringing the scapula, shoulder blade, the scapula upward. So that's attached here. But these, you see, they're attaching the side of the shoulder blade into the spine. So those are the rhomboids. We got in the front some that come from the inside, these reaching around here, and you can see that they come from the inside of the scapula and reach around to the rib cage. Those attachments might be nice to see on that picture that I created, that electronic favorite picture that I have, muscle picture I showed you before. And so we have muscles on the inside of the shoulder blade that attach it to the rib cage, on the back side that attach it to the spine, which is also the trunk. And then on the front, which brings it downward and inward, they're attached here to the coracoid process and bring the shoulder blade down. So that's the shoulder anchoring muscles. There's a few of those. And there's these cadaver clips. So if you like to watch those, go for it. I spent a lot of time on that. When I started, I don't know if I mentioned that before, when I started muscles for this specific technique that I do, which activates muscles that I use on athletes and active people a lot. And I went to Romanovsky, this old football guy who told me to study that technique. I used to go to his house, and I went one Friday, and I worked him for a couple hours, and then I went back home, and it was the thigh muscles actually. And then I really did the studies and just like spent 5 hours on dissecting those cadaver videos that I put on here and other things. Then I went back the following day, and he's like, "God, you really know your stuff much more today." And I was like, "Wow, it's interesting how fast study goes. If you really go engulf yourself in a material, you can get a lot done in some time." So it was very interesting to see the practical outcome of that. I didn't expect that. Anyway, that's just was interesting for me. The next muscle group is the rotator cuff muscles. And those are muscles that bring the arm muscle, the humerus, into the shoulder blade. So they're attached to the shoulder blade in the back and in the front also. So I want you to, see, there's no picture from the front, the subscap, but you can Google that or have it in the booklets or on the video as well. Then from there, so those are anchoring muscles. The rotator cuff are anchoring muscles, and they always work. That's one reason why this one on top here, the supraspinatus, is one that often gets injured in what we call rotator cuff injuries, or frozen shoulder injuries are part of that too. And then from there, we go into the muscles that move the upper arm. That's the humerus. They move the humerus around. Those muscles are deltoids, latissimus. These muscles here on the side, they bring the humerus up. This here is the swimmer's muscle. They bring the humerus back and downward. Or here we got the pecs. They bring the humerus inward. And so we talk about those in there. And then from there, we go to the elbow muscle. The elbow muscles are the front of the arm muscles, of the elbow movers, I should say. Elbow movers are the muscles that move the elbow. So mostly what that does elbow-wise is flexion and extension up and down. Forearm wise, we also go pronate, supinate. We bring the palm up and the palm down. That's also a little bit done from up here, but mostly in the forearm. So when we look at those muscles, then we move the elbow up and down, flex and extend. We have muscles in the front and muscles in the back. And so we're looking at the biceps, the triceps, brachialis, and then also brachioradialis is part of that too, which is all of the brachio stuff. Look at that, brachio. Somewhere there should even be the coracobrachialis. I don't even know if I have that. All of those, no, look, that's here, coracobrachialis is another brachio. That's an arm mover. But all of those with brachio, you know, they are right up here in this humeral area. That's why they're called brachio. So that's another way of looking at muscle. You know, you see a name, you go like, where could that be? Or what could that do? And then usually muscles name describe functions, describe location, or describe muscle attachments, like Sternocleidomastoid is an example of that. And then lastly here, for our studies, we go to the forearm muscles, and those are the muscles that move the wrist. So the wrist motion is, a lot of it is flexion extension, wrist upward and downward, and then a little sideways bending, a little this way. And then also palm up and palm down. And so we have a few muscles are here, the pronator muscles. And so the wrist flexors are in the front and the wrist extensors are in the back. Those, you know, spend a little time on looking at those, and then next week we can go and study those more, or we can also do a Q&A session later on in the week when you've already gone through the material a little bit on that front, and then answer more detailed questions and make a video of that. Did that Q&A video, did you guys watch that? I didn't look how many people watched that. Did some of you guys watch that?
Yes.
Was that helpful?
Yes.
Yeah, very.
Yes, very helpful.
So please then, you know, that was 2 people on the call, and then we just made a little video. So if you got, you know, if 1 or 2, we make a session like that, we could do that every week and answer some of the, because most people have a similar problems, you know, the most questions are similar questions that come up. So I think that might be a really good format. So I really appreciate you guys reaching out to me. So that's the lecture. And then we got, of course, the integration questions. There's 14, there's not that many here. And then we got the label coloring, and also make sure you answer the questions also, because writing it and thinking through it and writing helps slow it down a little bit. And so that's why I want to do those like that. And then I want you guys to do a little evaluation discussion, posture evaluation discussion, just briefly talk about it like we're used to at this point. And then the last integration exercise for this week or the next 2 weeks, I think I'll do it, it's a 2-weeker, is the injury prevention. This one I'm really proud of, actually, because what I have done is I've taken multiple seminars on these orthopedic type tests that don't take much equipment or no equipment at all, but are very indicative of things that are wrong on a musculoskeletal apparatus situation. And so this seminar I created, and I grouped together 13, I think it's 13 tests that are that regiment that look at muscle groups or stretching things or balancing or things like that, that are the biggest reasons why people have injuries and create injuries. And, you know, like, you know, you're probably now in your 20s or so, and so you have a lot of give, but once we reach the 40s and upper, a lot of things show up, and then these things become injuries. And so I was thinking creating a pamphlet that is easy to understand, because when I did these orthopedic tests with these doctors, it's all complicated wording, but it doesn't have to be. It's just, I don't know why they do that. But I created this pamphlet for my patients, and they go through these tests and see how do they do. And so the first one here is a one-legged balance test. And so you go and you balance on one leg, and then you open your eyes, and then you close your eyes, and you see how long can you hold it before you fall down. So hold yourself on a wall or so. And you see then there's the age group, you know, 60, we should all be pretty good. And then afterwards we sort of decrease. But I can guarantee you there's people in this class that cannot do this, even if they're only 20. And a lot of them can. But it's good for us to understand, oh, look, I'm a little bit weak on that. So maybe I should do some balancing exercises as I want to. But at least I have an idea of what's going on with my own body that way. Repetitive squat is another big important one to integrate and see how are we in getting off of his chair. Now it's how many squats can we do. At 80, it's can I get up and down of a chair. Which is most important to be able to walk, and ambulation is most important to survive. Once we can't get out of a chair anymore, there is a lot of issues that come, and the demise is usually closer, unfortunately. Side bridging, we're talking about these oblique muscles, so that's also important, et cetera, et cetera. Then we got a few tests that are the hammies, how flexible are the hamstrings. If they're not going all the way up, we gotta, if you start buckling your knee at this level, your hammies are stiffy. The whole back to the forehead is all connected through the fascia of the hamstrings, the gastroc, and the sole of the foot. So if this is too tight, you're gonna pull on here or here, and then you get injuries in this area maybe, or pain. It doesn't have to be an injury, but so so it's good to understand this situation, how you do in this, how are you faring? And if you're not good, then maybe do a little bit of stretching. Instead of sitting on the couch watching TV, maybe sit on the floor and stretch those things out a little bit. And then that will help you, avoid pain later on. Ankle is also important. And the ankle is interesting. I'm, you don't have to exactly measure it, but you can kind of see if you're flexible or not. What's interesting about the ankle is you have two muscles. You have one muscle group, the ones that bulge out in the back that we can usually see bulging out. They reach all the way up to the thigh bone, the femur. And so when we stretch that, we want to keep that knee straight. But then we got a deeper muscle. It's called the soleus. We'll learn that next week. And that muscle is deep in the calf. And that goes from about here down to the heel. And so we want to stretch that. We're going to bend the knee, and then we get access to that muscle. See, they outline it in here, I think. Yeah, down in here, that darker spot. So that's cool for that. We have a few more, some sit-ups, lowering leg tests, et cetera, et cetera. And then lastly, but not leastly, we have the 3-minute step test, which then gets us into the heart chapter. And so I want you to go through these tests. You have 2 weeks. Don't just do it all. Do not do them. Oh, I said 12. I thought it was 13. Well, either or, 12 or 13. That if you have pain, stop them, don't do them, talk to me. I do not want you to hurt yourself, but most of you guys should be all right. And then I want you to ask these different questions as you go through the exercises and answer them questions, and then upload your answer onto Canvas. And then that's it. Creativity, of course, is always welcome. You're happy to draw a picture, make videos, make audio recording. Any of that is always very welcome. Oh, look at this mess in my old room. This is a video that I did when I started teaching that the first time, so it might be helpful to watch it or not, depends on how you like to do that. But that's the integration exercise for this week. And let's see, I think that's it after that. All right, good. You are so patient with me. Let's see. Yep, that's it. The rest is just a little Padlet, which we do every time, and that shouldn't be a big deal. All right, any questions, you guys?
No.
Good, then we'll quit it. Let you go. Thanks for being so patient and holding on to it.
Good session.
Thank you. Bye.
Good. Well, I'm glad. If it's too long, let me know. I'm very happy to do them, and hopefully they are helpful. Good.
Thank you, Professor. Have a
Thank you, Professor.
Good.
Thank
Have
you.
a wonderful week. Reach out if you have a question. If you want to do a Q&A, please do so. I love talking about this stuff. As you can tell.
Bye.
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 Bye, Professor.
Bye.
Professor, can I just ask one quick question?
Mm-hmm.
Um,
Hold
for
on. Do you want me to turn the, where the heck is
Yeah.
my recording? Uh-oh. Did I stop the recording? God. I must be silly here. Hold on.
Hey, Professor, when can I
Okay.
book a session with you so you could